Once the patient referral, triage, and consultation has been completed, and the decision has been made for this patient to receive an inpatient chemotherapy protocol, the provider will request a bed via paper process. The patient will then be admitted, chemotherapy treatment will be ordered and administered according to the protocol, and the patient will be discharged with a subsequent admission planned. This video will start with the clerk pre-registering a patient. Once the bed request has been received, the clerk can go ahead and pre-register the patient. The clerk can do this by accessing PM Office and going up to Conversation, selecting Pre-register a patient to a bed, and then locating the patient by the patient demographics. Once we've located the patient, we can then go to Add Encounter. For the purposes of this video, this patient will be admitted in the future to Lionsgate Hospital. Select OK. Now that the patient information has been found, we can go ahead and enter in the encounter information, and we will fill out all of the required yellow fields. Hematology, reason for visit is chemo. We are going to select 6 East at Lionsgate Hospital, and for the purposes of this video, we will estimate the arrival date to be today. Once all of the required fields have been filled out, we can complete. We will not print these documents at this time. And now we can see that a pre-inpatient encounter has been created for this patient. Once the pre-inpatient encounter has been completed, the patient will be notified of their upcoming admission. For the purposes of this video, we will now say that the patient has arrived on the unit and has presented to the nursing station, whereby the unit clerk will register the patient by changing the pre-inpatient encounter to an inpatient encounter and giving the patient a name band. To do this, the clerk will go register a patient to a bed. We'll once again locate the patient by the patient demographics. Once we have found the correct patient and the correct encounter, we'll click OK. Now we can go ahead and go to encounter information and change this encounter to an inpatient encounter. We will continue to fill out the required fields. This is going to be a direct admit for chemotherapy. We will say no to arriving by ambulance. We will select the bed availability to find an available bed that they can be admitted into. We'll click here. Ward. We do have to select an admitting provider. And an attending provider. As well as to verify the primary care provider. We can go through these tabs to ensure that all of the required fields have been filled out. And now we can complete this inpatient encounter. We will not print these documents just for the purposes of this video at this time. Now that the patient is registered and an inpatient encounter has been completed and created, the nurse can begin her assessment, including her height, weight, and BPMH. Now the nurse can log into PowerChart and complete the BPMH and double-signed height and weight. To complete the BPMH, the nurse will need to complete the basic admission information adult form. So first, she will establish a relationship. And then she can go into this form. It is a requirement of this form to verify the allergies and to document the dosing weight. And then from here, she can document medications by history. So here we can see that the patient is taking Pantoloc and Ativan at home. So we can verify this with the patient and select done, at which point the nurse can then sign her form. And now the BPMH is complete. The nurse can then enter into the patient's chart to document the double-signed height and weight. She does this by going into iView, selecting the oncology assessment band. Here we will see the weight that was documented just now. We can enter in the height of 165 centimeters. And then we can go ahead and enter in that it was double-signed. Now, once the nurse signs the form, it'll prompt for a witness. So we can enter in the witness's name. Select OK. And at this point, the witness can sign. Now that the nurse has completed her BPMH and double-signed height and weight, the provider can now complete the MedRec, the chemotherapy dosing form, can write the admission orders, as well as place the chemotherapy regimen. I am now logged in as a provider in PowerChart, and will begin by locating the patient and clicking on their name to enter the chart. From here, I will establish my relationship with the patient and click OK. It is recommended that the provider completes the MedRec prior to placing any orders. So to do this, the provider will select current medications, and up here we can see that the nurse has completed the meds history or the BPMH. So now the provider is ready to click on the admission MedRec form. The provider can see which meds the patient has been taking and can choose to continue or stop the meds that are here, and can then press sign. Now that the MedRec is complete, the provider can confirm the double-signed height and weight by selecting Results Review in the menu. If the provider right-clicks on the height and weight and selects View Details, and then goes to Action List, the provider can then see who performed the double-signed height and weight and who the witness was. Now the provider is ready to document on their chemotherapy dosing weight power form. So to do this, the provider will go to Vital Signs and Measurements, select the chemotherapy dosing weight form. Here we can see a list of historical measurements, and the provider can select which height and weight they wish to choose for chemotherapy dosing purposes, and then can press sign.
Now that the chemotherapy dosing weight power form and the med reconciliation has been completed, the provider can now enter general oncology admission orders as well as the chemotherapy power plan. These can be found to the left on the menu. The provider clicks to add orders and searches for the general oncology admission order set. Selects. This order set has now been populated within the patient's power chart but is not signed. The provider can order and modify anything off of the set. For the purposes of this video, we will not order anything. We will note that there are the options within this general oncology admission order set for an oncology specific bowel protocol, oncology specific nausea and vomiting module, as well as a VTE prophylaxis module. Once the provider has selected what they would like from this general admission order set to have ordered, they will select Initiate Now, select the patient's code status, and sign. From here, the provider can now enter the chemotherapy power plan. For the purposes of today's video, we will select the high-dose methotrexate inpatient power plan. The provider will go to Orders and Add and search for the high-dose methotrexate power plan as inpatient. From here, the provider can choose what the estimated start date will be. For the purposes of this video, we will select today, and OK. And here we see that the power plan has been populated into the patient's power chart. Nothing is signed yet. The provider will click Start and will confirm chemotherapy to start today. For the purposes of this video, we will extend the start time to 1400. And here the provider can see what will be ordered within this power plan: diagnostics, pre-treatment labs, chemotherapy-related labs, alkalinizing regimen, and chemotherapy, plus chemotherapy-related orders. Here is where the provider can select to have this power plan reviewed by another provider. If this is selected, the nurse will not be able to activate the orders until this power plan has been co-signed by another provider. For the purposes of today's video, we will deselect this and click OK. Here we can see the selections for diagnostics, pre-treatment labs, chemotherapy-related labs, alkalinizing regimen, and chemotherapy, and also chemotherapy-related orders. For the purposes of today's video, we will deselect diagnostics, but we will order all the other selected orders. Here the provider signs. With the chemotherapy itself, a dosage calculator will be populated, and this is where the provider can confirm that they want 100% of this calculated dose, and this has been based on the double-signed height and weight of 65 kilograms and 165 centimeters. If the provider is happy with these numbers, they will click Apply Dose. Click Sign. Refresh. And we can now see that these medications and orders have been signed and are ready to be activated and processed. If for any reason the provider would like to adjust or confirm the dose of the chemotherapy, they may click on the chemotherapy order and click on the dose calculator and make possible adjustments within here. Now that the provider has completed the general oncology admission order set, as well as the chemotherapy orders for high-dose methotrexate for inpatient, they can go on and complete their admission documentation. This can be found in Provider View under the Admission M page, Oncology Admission Note. Here, any medications, procedures, diagnostics, anything that's been completed on the patient, including the height and weight, dosing form, information has been populated into this form, and the provider can complete any free text as as they wish. Admitted for high-dose methotrexate. You can insert free text here in the assessment and plan to initiate and administer high-dose methotrexate as planned. Here the provider can save, sign, and submit. And sign.
This is the Pharmacy Oncology Review List. This is available on the pharmacist position in PowerChart, and you can get to it by clicking on the button here on the top. So on this page, you have the start date and end date. So this will retrieve the patient list for the power plans landing on those dates. You have the site dropdown, which you can use to select the specific site. Our site is Lionsgate. And then the unit dropdown, which you can select all units or a specific unit if you know where your patient is. In the show dropdown, we're going to look at the inpatient orders exclusively, but you also have appointments and some other options here that we're not going to go into today. There's a lot of patients here, so we're going to drop down to the very bottom and then look for a patient. So I'll search for SPH, and that gets us your patient at the top row. And we'll take a look at the three icons on the left-hand side. We have a folder, which opens the patient chart. The plus icon, which opens the power form that we'll be documenting on momentarily. And then the wrench, which brings up a pop-up. And you can document clinical check and lab check NA. And that's a quick way for you to document that the checks are not applicable, even without having to document in the power form. Before we document on the form, I'm going to copy the plan name. And then let's document on the form. So from this, we're going to paste the power plan that we just copied. And then input the correct cycle and day number, so 1 and 1. And this is how the M page knows that this form is corresponding to the one that we're adding the note for. You have the pharmacist 1 and 2 fields. 1 is always going to be you, and then 2 will be the double check pharmacist. You can do this now, or you can do this later. You can always come back and update the form as needed. You also have boxes for clinical check and lab check completed. So you'll select yes or not applicable, and depending on which one you select here, it'll update back on the M page with your selections. And then on the right-hand side, you have pharmacy clinical checklist. So all the different clinical checks that you're performing, you'll select all of them. And lastly, we have the comments box where you can input any other information or any additional clinical checks that you're providing. Once you're done, you're going to select the green check mark icon on the top left-hand corner, and that'll save the form. Once the M page refreshes, you'll see that the columns have updated appropriately. But if you accidentally checked lab check as NA, you can always go back to this form and notice that the icon is now a clipboard icon instead of a plus. So if you click back on it again, it brings you back to the form. So you can update the lab check to yes, and then check off. And then the M page will be updated appropriately. Now that the checks are done, we'll verify the medications. And to do that, we'll click on the PPM button up at the top. And that takes us to the pharmacy patient monitor. So the PPM shows all the different medications that are set to be verified. We're currently at the LGH site, and there's a lot of patients. So just like we did on the M page, we're going to search for SPH. And that takes us to our patient. And if you scroll all the way down the right-hand side, there's a button for View and Process. View takes us straight to FarmNet for that patient, and then Process does the same thing, However, it queues up all the different medications for verification. So the 31 medications due to be verified, it'll queue up the verify action. We're going to click view since we'll only verify a couple of these meds. It'll ask us to select an encounter. So we'll select the appropriate one, Lionsgate. And this is our patient in PharmNet. We're only going to verify a couple of these meds. So we'll do a pre-med and a treatment med. And then press apply on the bottom right-hand side to start the verification process. You have to select the facility we're dispensing in. So Lionsgate. And this is a push for ondansetron, so we'll select med. And this is where, as a pharmacist, you'll be doing your clinical checks. So the right drug, right dose, right route, right frequency, right dispensing, any other clinical checks that you might need to do. And once you're finished, click OK. This is a pop-up for allergy review. We'll ignore this for now and press OK. And now a treatment med. So we'll click intermittent. So at this point, you can select a specific product and then attach a diluent to it later on. Or you can go to the IV sets tab and select one that may be the most appropriate. We'll select the liter bag option here. This may not be what you do in practice, but for demo purposes, we'll select the liter bag. You'll do the same clinical checks we did for the ondansetron. And then once you're finished, press OK. And the double arrows indicate that these orders are ready to be submitted. So once you submit them, they will be finalized onto the patient chart. Okay, so on the submit on the bottom right hand corner, and the verifications are now complete. There's one other place you can document the clinical check power form, and that's within PharmNet. So if you go to the bottom left hand corner where it says RX Interventions, you can click on the plus icon, and then in this pop-up, select the clinical check, then chart. And this takes us to the power form we documented on back in PowerChart. So as long as you have the protocol, code name, cycle number, and day number, this will tie back to the end page and update those lab and clinical check columns respectively.
While the pharmacist is verifying and processing the orders, the oncology nurse can simultaneously be completing their chemotherapy and biotherapy checks.
So from my Care Compass, I can see that a new plan has been added for my patient. When I click on it, it takes me directly to the orders. I'm going to be keen to get my lab results, so I'm going to go ahead and activate the lab phase of this order, of this plan. And while I'm waiting for the results, I can continue my pre-chemo checks as required by my health organizational policy. I'm likely going to have to look at the provider's documentation, so I can come here and have a look at everything that's been done. I can see that the pharmacist has completed their pre-chemo clinical check. I can see that the provider has completed the chemotherapy dosing weight. I can see that 65 kilos, 165 centimeters, and the body surface area was done. The next thing I'm going to want to do is check the orders against the protocol. From the orders view, I can go right into the protocol. I can link to the protocol, and I can review it and check it against my orders. I can toggle back and forth between the actual orders and the protocol. While reviewing, I can see what the chemotherapy doses are for this particular protocol, methotrexate 8 grams per meter squared, and then I can have a look at the provider's orders. I can see my order for methotrexate here. When I click on it, I can go into order information. I can click on the dose calculator. I can see that the target dose is 8 grams per meter squared. I can see my height and weight that I looked at on the power form, the dosing weight power form, and then I can close that out. I can continue to look back and forth from the protocol to the orders until I'm satisfied that I have checked everything that I need to in the orders, and then I can go and complete my pre-chemo symptom assessment. I do this in iView. And I can come here to the NCI toxicity criteria and go ahead and document any symptoms that my patient has been experiencing. Once I've done that, I'm going to sign my values. When my lab results are available, I will be able to see them in lab results here, or results review. Nothing is in the system at this point in the practice domain. After I've looked at that and I'm completely satisfied that I've checked my orders, my patient is ready to go for the chemotherapy, then I can go ahead and document in iView, if required by my policy, my chemotherapy and biotherapy verification. Today, my patient is getting methotrexate, so I can look for that in this list of medications. I can verify that the height and weight was checked, and that as nurse 1, I have completed my verification. And I'll go ahead and sign my results. I am now ready to communicate with pharmacy that my patient is ready and that I am ready to go ahead and administer the chemotherapy. This process is done via the phone or whatever local process the health organization has set up. And now I'm ready to go back into my orders and actually activate my chemotherapy phase. For the design of inpatient order sets, the recommended workflow is to select Activate All. So I'll go ahead and do that in this case. I'll have to do orders for signature, a last look at everything that I'm signing at this moment, activating, click Sign. And refresh. The action of activating these orders puts the medications on the MAR. There are several phases to inpatient order sets, and they need to be activated as required by the nurse. And of course, education will be delivered to cover all of that. So I'm going to go ahead and look at my MAR. The recommended workflow is always to look at plan view for chemotherapy. I can see that I have some pre-medications that are due first, and then I have the methotrexate to follow shortly thereafter. I'm going to go to the MAW, Medication Administration Wizard. I would scan my patient's wristband, and it's going to bring up the medications that are due within the next hour or that are past due an hour. First thing I'm going to do is select my ondansetron and go ahead and sign for that. And after the appropriate amount of time, I can go ahead and administer my methotrexate. For the methotrexate, I'm going to want to have a cosign on that. So I can come here to Chart Details, and I can get my co-signing partner or my witness to come here, and I will enter their credentials, or sorry, I'll enter their name. And search for them in the list. When I find my partner's name, I can say OK. When I sign, they're going to be required to enter their password. And you can see when I do that, that the medications fall off of the medication administration wizard, and they show as complete in the MAR. This happens to be a single medication protocol. If I needed to continue with more medications, then I would just repeat that process as required.
When the provider is ready to discharge the patient, they should work from the discharge workflow page. They will begin by completing their discharge med rec. I can see any medications that the patient is still on and determine whether to continue or discontinue. And here's where I can add any protocol-related required medications. For today, I do not want to send this to a printer. I can complete any required details and then sign. That shows that my discharge med rec is complete, and now I can place the discharge patient order. And then I'm going to go ahead and document the discharge disposition. And then I'm going to create my discharge summary note. I can see here that relevant information will automatically pull in. So it has my diagnosis there. I can see the medications that I've reconciled, the ones that I've stopped, and the discharge disposition. When I'm satisfied that I have all the details that I want in my note, I will sign and submit. I can choose providers that I want to distribute this to. And then the provider's work is done for discharge. Working from Care Compass, I can see that there's a new order placed on my patient or a new result. Sorry, refresh. And I can see that there's a discharge order there on my patient. I'm going to mark that as reviewed, and then I'm going to go in the patient's chart. As a nurse, I also have a workflow page for discharge. I can review any active issues for my patient on this during this admission. Review the discharge medications that have been reconciled. I can see the provider's discharge documentation has been completed. I can open that up and review it. I can see any orders that I need to make sure I've completed or determine if there's any action that I need to take there. And then as a nurse, I can go ahead and do any documentation that I'm required to do. There are several forms here that the nurse can use to complete her discharge documentation. And once I've done that and I'm ready to let the patient go, I've given them all of the printed requisitions, any prescriptions, any education material, and I've completely finished with my patient's chart, then I can speak to the unit clerk and ask her to discharge the patient's encounter. PM conversation and choose Discharge Encounter. There are a few mandatory details. Discharge home without support. Hit complete, and that is going to discharge the encounter.